Stellate ganglion block has many indications. Some of them are painful conditions like complex regional pain syndrome and post-herpetic neuralgia. It is also indicated in some non-painful conditions like Raynaud's disease and hyperhidrosis. The stellate ganglion is composed of fusion of the inferior cervical ganglion with the first thoracic ganglion. It is situated in the region of the lower part of C7 extending to T1 transverse process. Attempts to block the stellate ganglion at C7 to T1 may result in several serious complications at this level, and thus it has been considered safer to block it at C6 instead. Performance of stellate ganglion block at C6 level relies on a planar spread of the local anesthetic between the prevertebral fascia and the surface of the longus coeli muscle in order to block the stellate ganglion. The longus coeli muscle extends in the neck in front of the vertebral bodies and transverse processes of C1 to T1. A high-frequency linear ultrasound probe is used. Transverse scanning can begin just above the clavicle to identify the carotid artery. Then deep and lateral to this can be visualized the pulsatile vertebral artery and the C7 nerve root lateral to it. From this point, scanning upwards will bring the C6 transverse process with its characteristic anterior tubercle into view. Superficial and lateral to the longus coeli may be seen a smaller muscle, which may be the longus capitis muscle. The needle tip's target will be a plane deep to the prevertebral fascia between the longus capitis and the longus coeli muscle. Once the target is identified, the probe should be adjusted such that the lateral end of the probe just overlies the ultrasound image of the anterior tubercle and not the corresponding foramen. If the needle hits the anterior tubercle of C6 transverse process, you have to walk off the anterior tubercle to reach the plane between the longus coeli and the longus capitis muscle. A final volume of 4 to 5 ml may be adequate, and the expected development of Horner syndrome as a sign of successful block should be explained to the patients before the procedure.